Okay, before we end this presentation and leave you on your way to start tasting sessions with your child, there's a few points I want to talk about and then some common mistakes. Remember that teaching your child to learn to accept new foods is a process that definitely takes time. The focus should be on developing your child's long-term palate for a variety of tastes as opposed to short-term quantity. And remember to keep your expectations small to start. We want you to be successful with feeding your child. So if you're introducing strawberries, please don't make the expectation that your child eats a full strawberry on the first sitting. Try to aim for even just a few, your child chewing and swallowing a few small dabs of a strawberry to start. We recommend allotting 30 minutes a day of daily practice during a time of day where you have the time to sit down with your child and fully concentrate on working on these foods with your child. So don't do this during a mealtime routine. We recommend outside of a meal, and simply because during meals you have competing responsibilities, and it'll just make it so much harder to focus on the strategies. This takes a lot of time and effort. We're asking you to learn how to use, I think we discussed 10 strategies in this workshop, and so using 10 strategies in a session takes a lot of brain power and focus. And certainly enlist others to help you with implementing the strategy. Chantal just said that they trained RB's home team to help mom, and so we highly recommend you enlist the support of others. The more people helping you, the more successful this will be. And here are a few common mistakes we've seen parents make over the past 15 years. The first is presenting too big a bite to start. Pay attention to the size of bite and err on the side of smaller size bites until your child is confident in consuming bites with ease. In our sessions with children, the size of bite is the biggest trigger for problem behavior. So if the goal is practicing tasting new foods and not consuming portions, start with offering your child a size of bite as small as a crumb and working your way up to just the size of a dime. If your child's accepting 10 dime-sized bites of food, you're on your way. The other error is not having scheduled meals and allowing your child to graze. Make sure your child's not consuming high-calorie drinks or snacks at least 2 hours prior to practicing a new food with them. If your child's not hungry, they're not going to be motivated to try a new food. Certainly, highly preferred snacks and drinks can be used as part of your tasting session, contingent on trying bites of food, but your child really has to be hungry for a session. And remember that teaching your child to like a new food does not happen instantly. Learning about a food and developing a preference for that food is a process that can only be achieved through practice. The more you practice, the more familiar a food becomes. The more familiar a food, the more liked it becomes. So practice often and don't treat those initial dislikes as permanent. And finally, there is no one more important in this process than you, the parent. We say this all the time to parents. How you structure your sessions and how you support your child will greatly influence the success of this treatment model. Consistent use of all the strategies is necessary in promoting eating behavior in your child. Fading out strategies too soon will likely lead to refusals. And the most common strategy parents fade out too soon is the use of rewards. Remember that this is an incredibly challenging skill for your child, and so extra motivation is needed to help them overcome their fear and take that bite of food. Okay, so we just have a few what ifs to end this presentation. The first one is, what if I've tried rewards, but my child still won't take a bite? And this happens to us in sessions. We'll have tried everything and it's still not working. And it's likely that the food, either your child's not hungry, which often happens, or your child's unwell, so there's some sort of physical factor that's contributing to the selectivity, or the food is too difficult. So we've talked about this before earlier on, that sometimes it's too soon. The food's just too challenging and you need to put it on hold and try again at a later date. Or perhaps your expectations are too high. Maybe you're asking them to eat too many bites in a row, or maybe the size of bite is too big. Or maybe you just need some professional support. Someone who's done this time and time again who can help you through these moments. Another what if question is, what if my child is now dependent on the iPad for meals? So the scenario we're thinking of is when your child's eating a variety of new foods, but they're needing the iPad as a distraction to keep them eating and eating at a decent pace so you can get through a meal within 30 minutes. And if this is the case, we certainly don't want the iPad to be a fixture in your family meal routine. We definitely need to get that iPad removed so that the child's paying attention to what they're eating and interacting with other family members. So the way to do it is not to just remove the iPad cold turkey. That's likely going to lead to a lot of upset from your child. Instead, we recommend that you systematically fade out the iPad and do it in a very gradual way. And so I'm not sure if I can show this video, but I can explain to you. So perhaps a mealtime is about 35 bites. We recommend moving to the first bite of the meal is contingent, meaning the child has to eat a bite of food in order to earn the iPad. And then the next 34 bites, they can have the iPad free access to it. And then the next meal, you make the first 2 bites where the child has to earn the iPad. So eat your 2 bites of food, and then you can have access to the iPad. And then you build in another expectation the following meal, 3 bites, until you're at your 35 bites where the child's eating the entire plate of food and then earning the iPad. And what if this never gets easier? So a lot of parents ask me this question, and it certainly is hard work. We in our work, we do a lot of the promoting the initial change. We set kids up on a new trajectory of eating, and then we ask parents to take over and maintain that progress and continue to introduce new foods. But nonetheless, it's still hard work. We ask parents to continue to practice foods. If you stop practicing foods, the foods will become almost forgotten for the child and that'll return to something new, and it'll require more effort. So we want you to continue to practice foods that your child will learn to eat, as well as add new foods. And this certainly can take a lot of time. We ask parents to commit to the process for about a year and trust that this will improve over time, especially if you continue to use the strategies with accuracy. So this is a timeline we share with parents when we're intervening, and it just outlines the expectations per phase of our treatment model, as well as the expectations, as well as level of intensity in terms of support. So during the therapist-led part of the intervention, the first 7 to 9 days of therapy, when we're promoting that initial change, the goal is to just introduce small bites, and we're slowly, we're using all the strategies. When we move into parent training, we're continuing to work on just small bites of foods. Perhaps if the child's relying on milk or formula for calories, we're starting to reduce their consumption of that by 25%. And again, the expectation is for you to use all the strategies. 1 to 2 months following intervention, there's still this expectation you continue to use all the strategies. For some of the easier foods, now you're able to increase portions and fade out some of your strategies. And if your child's relying on milk or formula, you've reduced that now to 50% of their daily intake. And it really isn't till about a year when you can confidently present your child with a plate of food and expect them to eat it with relatively few strategies, or perhaps they're so automatic by now. You've used them so much that they feel like second nature to you. And maybe only when a new food is introduced that you're going to have to use a couple strategies to motivate your child to take that bite. So again, the focus is on long-term taste, not short-term quantity. And then what if this doesn't work? Well, it's likely that there isn't sufficient practice or opportunities or presentations of the food. So we talk about this often in our work. It's not intensive enough. We need to see your child more. We need to practice these foods more often across the day. Or it's likely you need some professional support to promote that initial change.